Welcome to the world of medical record storage, where data is growing at an exponential pace, where security threats are high and compliance demands are even higher, and where patient records must be available on demand to a growing number of client devices. Today's siloed storage infrastructures magnify the problem. Because storage is often isolated by department, records are more difficult to share across departments, frustrating doctors and nurses. And the infrastructure is more difficult to scale and manage, resulting in frustrated IT personnel, higher costs, and poorly utilized resources. Fortunately, there is a better way, with scale-out and virtualized infrastructure based on Intel technologies. So what are these technologies, and how do they help? It starts with powerful Intel Xeon processors that deliver intelligence to storage devices, enabling you to create a common, centralized storage infrastructure for all your data across all departments. One innovation built into those processors, Intel AES-NI, enhances security by significantly accelerating encryption and decryption. Intel solid-state drives can further assist encryption through built-in hardware that can offload that task when storing data, while delivering superior Tier 1 storage performance and responsiveness when accessing records. And Intel Ethernet 10 gigabit server adapters not only improve performance, they enable you to unify your LAN and SAN onto a single network infrastructure to reduce cables, cost, and complexity. The end result? A simpler, more scalable, and efficient infrastructure. But what does it all mean for IT and for the medical professionals who rely on those records? One major advantage is that security innovations like Intel AES-NI can help organizations mitigate the risk of security breaches and better meet regulatory requirements by protecting medical records at rest and in transit without incurring the typical performance penalty. That's important so that users aren't motivated to use less secure public file sharing services. Intel AES-NI is also built into client devices featuring second-generation Intel Core processors, so you can achieve end-to-end data protection without compromising your user experience. Another advantage is that data can be securely moved into the cloud, so doctors and nurses can quickly access any patient data, anywhere, on any device. Intel Xeon processor-based storage devices can recognize the capabilities of requesting client devices to maximize the end-user experience based on those capabilities. For example, software on intelligent storage devices can shrink massive DICOM images so they display optimally on those devices, all while reducing traffic on the network. Inline deduplication is another huge benefit. Too often, redundant data is stored and archived unnecessarily. Intel Xeon processor-based storage systems have the performance to power intelligent software to automatically compare data inline during backup to data already in the storage archive, eliminating duplicates, freeing capacity, and reducing backup time and network bandwidth requirements. Tiering is a benefit that improves utilization and cost-effectiveness by intelligently monitoring and anticipating data usage and automatically moving data across tiers to balance and optimize responsiveness, capacity, and cost. For example, records can be continuously monitored to identify their activity levels. High-activity records can be moved to high-performance drives, while low-activity records can be moved to less expensive Tier 3 backup systems. And by interfacing the storage system with the scheduling system, that patient's record can be automatically copied to Tier 1 storage when they have an upcoming appointment, making it instantly available to the doctor during that visit. These are just a few of the advantages that a virtualized, intelligent storage infrastructure based on Intel technologies can bring to the healthcare industry. Please visit us on the web to discover more about these advantages and the technologies that enable them.